Welcome back to the Michal Jackson Show on News Talk 1260 and 540.
Our phone number, 1-888-458-1260. Our phones are already ringing busily because I mentioned what we're going to be doing this hour. It's going to be an hour of overload, and a very necessary and enlightening one, I hope. Two words will be heard a lot: autism and stroke. So our conversations will range from so small and young to the damage done and lives taken by strokes. In fact, I believe that one of our callers will be a young fellow who survived a stroke at the age of 4. We're trying to get him. That I'd never heard of before. But what or why both ailments? Autism and stroke. Why on the same program in the same hour? Frankly, because I was familiar with an extremely talented man who deals with both situations. His name is Johnny Seitz. I've known him. I've known his work for, I think, 4 years. You may or may not remember that he was a fellow who basically masterminded, who aided and advanced and rehabilitated that great broadcaster, Dick Clark. Dick has worked extraordinarily hard himself and with Johnny to recover, and his advances from his pretty severe stroke have been wonderful. Johnny was, in the recent past, the cover boy on a couple of magazines, the American Stroke Association's Stroke Connection and Autism Perspective. Johnny, the first guest of the hour, but there will be many. Good morning to you.
Good morning, Michael.
Can you look me in the eye?
Yes, I can, if I'm not concentrating on what I'm talking about.
Really?
When I look you in the eye, I lose track of what I need to say, what I need to organize in my mind. I get lost in your thoughts and your feelings, and makes it very difficult for me to speak.
You are autistic.
Yes, I am.
How would I know it? You hide it well.
By the fact that I'm face blind. I recognize.
What does that mean?
I recognize you by your height and by your voice. But very, very frequently, the other day I was at my accountant's and I saw my lawyer, and I smiled at him and I waved and I started talking, and he looked at me and said, "Do I know you?" "You're not Mark?" "No, who are..." "Oh, sorry, never mind." I can't remember the faces of anybody in my world. I remember voices. I read bodies. I have to, because it's the only way I know what you're thinking, where you know me from, who you are to me, and how to communicate with you. But
Can I ask you very personal questions?
Certainly.
Do you still bang your head?
I still rock myself to sleep every night, and I sleep under a 40-pound blanket.
Which must be easy for your wife. He sleeps under a what?
A 40-pound blanket. You heard it here.
Chris Seitz, wife of, doctor, experienced. Will he always be autistic?
Yes, Michael. Autism is kind of like saying, is the ocean blue? It's something that's there forever. And, with work, with a lot of intervention, with a lot of nurture, with a lot of love and attention, you learn to accept the challenges of the other person, and then you help them also work through their own challenges.
If a stroke can be described as a medical emergency, okay, how would you describe autism?
Well, I think that they're both anomalies, differences in the brain. One affects the body and the body's ability to access and control the movements, sometimes the thoughts, the memories. Autism is very, very much the same thing. It's a neurological anomaly. I'm gifted with skills that other people don't have, and pay for it with deficits that can be very trying for my partner to cover for.
Is there any connection in any way, or are we really stretching it to talk about autism during the same hour that we speak about stroke?
Well, they both affect the family. They both change the entire world of the person and the family. At 18 months, the parent who finds out their child is autistic has to recontext their entire life. When someone has a stroke, the family of the stroke survivor has to immediately get used to the fact that their entire life is now different forever.
Dr. Potkin, are you there?
Yes, I am.
Is he giving me the facts of it all? I mean, how are you two related?
Well, actually, I was personally referred to Johnny to help my own lower back problems, which were related to bicycling.
Yes.
And I was so impressed by his unique approach to body mechanics that I knew that he could be very helpful to treat my stroke patients. Many patients have been referred to us to be treated with hyperbaric oxygen.
You run the hyperbaric
Yes, I'm the medical director of the Beverly Hills Center for Hyperbaric Medicine.
It works?
Oh, dramatically.
I know it does if I get the bends as a diver, but how does it work in other ways?
Well, it has dramatic healing properties, and it's able to get oxygen into tissues and cells that are damaged but not totally dead, so they can be rejuvenated.
So was it you, I'm putting these pieces together, who sent Dick Clark to Johnny Seitz?
That's right. Dick was referred to us for hyperbaric treatments, and he went through the...
for his stroke.
For his stroke, and he was making some progress, but I was sure that with assistance from Johnny, with his unique ability to get the body to function, even after conventional medical care had been provided, including rehab, that I thought the combination of hyperbarics with Johnny's body mechanic therapy would be superb for him.
Doesn't help somebody with autism.
Oh, that's not true. I think that, as Johnny had mentioned a few minutes ago, there are a lot of similarities with brain dysfunction in stroke and autism, and hyperbaric oxygen is being used nationwide to treat autistic kids.
By the way, you're the UCLA professor?
I am a full professor at UCLA, yes.
How would you know that somebody was autistic?
Well, I know one from the education I've gotten from working with Johnny.
No, but I mean, how does one know?
How does one know? Well, by a constellation of physical findings in terms of social abilities, verbal speech problems, and physical behavior. There's a syndrome that we can put together to identify who's somebody who's autistic.
I've actually been made on the street where someone walking behind me noticed the strange ways I walk around and over things, and she just said, "You're autistic, aren't you?"
Really?
Busted!
Has it held you back in life?
Oh, I wouldn't give it up for anything in the world. I think it's what
you wouldn't give it up for anything.
I wouldn't give it up for anything in the world.
What's the advantage of being autistic? Ralph, if you disagree with him, forget it.
Within about 2 minutes, I know an awful lot about a person's life, how they take in information, what traumas they've gone through. I actually teach a class. I'm on the faculty at the Ryokan College of Psychology, and I teach a course called Reading the Body for Psychotherapeutic Intervention. I begin the class with usually by picking somebody and saying, normal reactions to normal things are what they are. So I raise my hand as though to hit somebody. First class I did it, the woman just stood there, and I looked at her and I said, "Oh my God, did you see what she did?" And the class said she didn't react. And I said, "May I tell them what I saw?" And she said, "If you think you saw something." I said, "You get hit at home and you just learn to take it." And she said, "How?" And she started crying. "How did you know?" And I said, "Because you engaged all the muscles surrounding your neck and head in preparation to receive a blow, but made no attempt at defending yourself."
Do we have any idea why autism's on the increase? And it is, amazingly.
Ask my wife.
Wife? Chris.
Hello, wife. Well, there are a lot of reasons. One, the diagnostic procedure has really broadened. Two, there's been a lot of case studies, whereas before there wasn't that much of a budget. And so now you have a lot of private industry. The government is up in the research. So there's a lot more research and a lot more evidence is coming forth that was there all the time, but we just hadn't come across it.
I remember many years ago emceeing a telethon for autism. And my first guest was a rather well-known actor. And I expected one answer and got an entirely different answer to a very basic question. He had a son who was autistic. And I said, "I bet you're glad that you have that son." His response was so negative. I really got the feeling he wanted him dead.
That breaks my heart, because one time we were at an autism camp.
Yeah.
We were working with the siblings, the parents, and the children. And this man had a little boy that kept crawling around people's legs, trying to get somewhere like a little animal that wouldn't stop. And he said, if I had a pill that would make my son not autistic, I wouldn't give it to him because this is the son I love. And my parents did that for me, and we try to do it for other people in the autism circuit because we speak at conferences. That man had the right answer.
Michael, when we lecture at conferences, that's one of the messages we try to really bring to the people, is that we want to fix that paradigm of fix my child, and really look at the caretakers and their struggle.
Yeah, fix my family.
Yes.
What happens to couples who have an autistic child?
85% go to divorce. 85% of the husbands leave.
The husbands leave?
Yes.
So it's the women that have the you-know-whats.
Yes.
Responsibility to look after their children.
One of the things that I try to tell people at conferences is if we had gotten rid of those little autistic brats, we would have lost Michelangelo, Leonardo da Vinci,
Ike.
What?
Wasn't Eisenhower also?
I don't know about him.
I'm not sure about Ike, but certainly Thomas Jefferson.
I was thinking of one or the other.
Thomas Jefferson. Yes, there's a book
He
called...
could write backwards, couldn't he?
I can write backwards and forwards with both hands at the same time. That's how they figured out Leonardo
Do you
da Vinci.
mind if I ask you why you would want to?
It's a great code. No one has any idea what you've written. It's fun. And it makes people real impressed. So I love doing it because it blows people away. It's a trick.
You've got so many tricks going for you. Is it not true that you were a student of and you worked with the great, what's his name, the Frenchman?
Marcel Marceau.
Marcel Marceau,
Yes.
a pantomimist.
Yes, he was my godfather in the world of mime. He brought me to Paris, scholarshiped me, sent me off to study with his teacher, Etienne Ducroux.
He knew you were autistic,
I told him at one point.
but it meant nothing to him.
No, he dealt with people.
Well, so do you. Let's take some more calls. Our phone number 1-888-458-1260. Our subjects are everything from autism and the impact it makes on the child and the impact it makes on the family to stroke. Let's turn to stroke. Rick?
Yes.
You're an entertainment business executive. You suffered a stroke how long ago?
I suffered a stroke in January of 2007.
How serious? Of course, the obvious answer is, if it's you, it's serious.
Yes, it is a hard question to answer because I'm sure. I've been told that I got off easy. I'm paralyzed on my left side, but the doctors have told me that it could have been a lot worse.
Well, not a year ago. Isn't that twice the length of time that society tells us you can do something about somebody who's had a stroke?
Yes, there are. What I have learned as a stroke victim is there is a lot of stuff that the medical community, at the very most, doesn't really know about strokes, and there are theories that 6 months into it, a year into it, if you haven't, that's when you'll get back whatever it is you're going to get back.
So you were told that you would never be able to use your hand? Never be able to walk with a cane?
Yes, I was told not to be optimistic about that. I was told flat out that I wouldn't be able to work with either of my hands.
How are you now?
Well, I still have little or no ability with my left hand, but my right hand is quite functional.
What's the most recent advance you've made?
The most recent advance I've made,
Can you walk?
Yes, most recently, I'm quite proud to say, with Johnny's help, as recently as a couple of weeks ago, I managed to take 18 steps unassisted. And for me, that was quite a large accomplishment, considering that 6 months ago, I probably couldn't have taken more than about 6 steps with somebody holding me up.
Have you had to retire?
No, I haven't. I'm fortunate that I'm in a business, you mentioned the music business, of which I am involved in and have been all my life. The good news for me is a lot of my business can be done on the phone, can be done by taking lunches and dinner meetings and sitting in general meetings in offices, and I'm quite capable once I get into the office or I get myself on the phone to conduct business.
Rick, do you know why you had a stroke?
Well, I've asked a lot of doctors, and there seems to be the common answer is high blood pressure.
Were you aware of that and the possibility of your getting a stroke?
Yeah, I think probably as much as anyone is. I think we all know that high blood pressure is a bad thing.
Yeah.
If I could give any advice to anyone who is, I was going to say something like in the dangerous category for stroke. But
You're probably going to say, don't worry, and my reply would be, how do you don't?
No, I was going to say, watch your blood pressure, because my blood pressure was very much in check. I was under a doctor's care, and I was taking medication, and my blood pressure was fine when I had my stroke. However, prior to that, a year prior to that, it wasn't in check and it wasn't controlled, and the damage was done.
Do you have fear that you'll have another one?
Yes.
Should he, realistically?
The reoccurrence isn't that high, but what's important is that 50% of the people that have strokes have no symptoms whatsoever. Getting screening, I think, is imperative.
You do that? Rick?
Yes, I do. Yes,
I've got so many calls coming in. Maybe if there's time, I'll get back to you. But thank you for telling us that story so far.
Thank you, Michael.
Bye. So he's now walking unaided.
I am so... I'm just out of my mind joyous. He took 18 steps with no help whatsoever a week ago, and it's the greatest high in the world.
I'll bet.
And humbling. Oh, God, it's humbling.
Well, that's a first for you. Johnny Seitz and wife with us, and so many calling through. Our subjects are twofold, stroke and autism. Our phone number, 1-888-458-1260. I'm Michal Jackson. This is News Talk 1260 and AM 540. We'll continue in just a moment.
Here once again is Michal Jackson. Join the conversation. Call 888-458-1260. 888-458-1260.
Our guest, a renowned expert when it comes to dealing with autism and more with strokes. He's Johnny Seitz.
Good morning, Michael.
Morning, ma'am.
I have a question, and my daughter had a left cerebral infarct at birth, which is basically
A stroke.
Yes. When she was born, they said she wouldn't talk, walk, speak, eat by herself, completely be...
You were told this at what age?
Well, the day she was born, basically. 3 days afterwards, she had some focal seizures in her right arm, and they...
God.
Did a CAT scan immediately. They said there was a huge bleed on the left side of her brain, and then the prognosis was very grim at day 3.
How old is she now?
She's 10 now, and I want to tell you, she's a straight A student. She's a normally functioning little girl. She does have some issues with her right side as far as a walk and her fine motor, but she actually tutors children in her own class, and she's not in a special ed class either.
Wow. Wonderful. You must feel joy. However.
She had the very first generalized seizure last summer. And it came out of the blue, and I don't know where or why, and nobody seems to have an answer.
Wow.
I'm just curious.
Any comment, Johnny?
Well, mostly I'm just thinking that they thought it would be a good idea to put me in an institution and give up on me when I started banging holes in the wall with my head at 18 months. World, hear this. Autism and stroke is not final, fatal, or unlivewithable. Please, this is the one message I want to get out there.
Hold a moment. Holly, I hope that helps a little. I'm going to call next a woman whose 4-year-old had a stroke. That and a lot more. Join us. 1-888-458-1260. I'm Michal Jackson.
And now, more with Michal Jackson. Call now and share what's on your mind. 888-458-1260.
Okay, sort of setting the scene again because the phones are so busy. Our guests are an autistic adult who's overcome classic autism. He's married. He drives a car. You drive a car?
Yes, I do.
I won't go with you. And he runs a studio. He is Johnny Seitz. With Johnny is Chris Seitz. She's a marriage and family therapist who runs an autism program at the South Bay Center for Counseling and has many other qualifications. Our phone number busy, 1-888-458-1260. But the next call is TJ?
Yep.
Where are you, TJ?
I'm in Springfield, Illinois.
Oh, they all say that. Do you know how many Springfields there are in the United States?
Yeah, well, I'm actually in a town called Chatham. It's about 7 miles south of it. So.
Well, there are 28, and that's without counting West Springfield and the rest. Bill, how do you come to know Johnny?
Well, my brother's mother-in-law subscribed us to Stroke Connection magazine, and one day
he was the
we
cover
saw his
boy.
Picture. Yeah, and we saw his picture, and we were like, "Oh, this is interesting. Let's look at it." Then we read the article on Dick Clark, and we were pretty amazed. And then, especially when we saw Dick on the Rockin' New Year's Eve, we were just blown away because we
Dick Clark.
We knew that Dick Clark. Yep, we knew that he was worse than my father, and he was older. So we knew that there was definitely a way that my dad could get better because conventional therapy just wasn't working. So then...
1 second, Bill. Is your therapy unconventional?
Mine?
Yeah.
About as unconventional as you can get.
Well, then do doctors dislike you?
Strangely, no. We've done seminars at Veterans Administrations for neuropsychologists, PTs, and OTs, and they love it. How do I do it? It's real simple. I'm a mime. I become the person who's had the stroke. I assume all of the things that are not working on their body, and then with my because of my autism, I can put a hand on your body and literally see every single muscle, which ones are firing, which ones are not. I become the stroke survivor, and then I figure out using the assets that they've never discovered, the fine muscles that as a ballet dancer and a mime I use, if they could be brought on, how to unite the core, how to get the muscles working, which muscles need to be prepped first before you try to do something complex like walking.
Okay, TJ, on Thanksgiving Day, what happened?
After we ate, my mom was talking to my sister on the phone, and her words just kind of trailed off, and she didn't realize anything was really happening, and then we called 911, got her to the ER, and we found out she had, we weren't sure if it was from high blood pressure or what, but it was an embolus that got stuck and basically took away her ability to speak.
But you knew, they knew it was a stroke.
Yep.
How did you get... Oh, so the magazine brought you to Johnny.
Yeah, because my mom had her stroke first, and then 8 months later my dad had his, and then we were subscribed to the magazine, and then we discovered Johnny and contacted him by phone.
Has she made any advance?
What's that?
Has she improved?
Oh, yeah, she talks almost completely normally right now. She might forget a word here and there, but, walking down the street talking to her, you would think that she was perfectly okay.
And at first, how bad was she?
She couldn't understand anything, and we couldn't understand anything she was saying. Completely mute, basically.
Thank you for sharing that. I really appreciate it. Our phone number, 1-888-458-1260, 1-888-458-1260. So if I came to you with a child who's autistic, okay, I can't simply drop the child off. I mean, you must have to work with parents, grandparents, as many as you possibly can. What do I need to know?
I'm going to dump this one on Chris.
Well, I'd like to refer to your last caller. He said that immediately she was taken to the hospital, call 911 right away.
Yeah.
It's the same with autism. If you have immediate, appropriate intervention, you can then begin to see the parallels, because there's a lot of brain deficits with autism, just as there are a lot of brain deficits as a result of a stroke. So when you have a lot of intervention, in particular repetitive intervention, this really, really helps the neuronal connections to come back together and respond.
So autism is a social communication disorder.
It's a little bit more profound than that. My brain lives in theta. I've been tested on hooked up to machines, and all my brainwaves are normally in theta, which is like where people go when they meditate or levitate, I guess. Mm-hmm. So it means the immediacy of now is more intense for me than it is for other people. So the information I take in is a bunch more. I'm not anywhere else but right there with, whatever I'm doing.
Why don't autistic children very frequently not wish to speak or incapable of speech?
I think, first off, we don't normally understand the need for speech. We see people doing it and basically saying a lot of things that aren't true, aren't what they mean, and we tend to tune out, like, why are you telling me this when that's not at all what you're trying to communicate?
Also, sometimes there's a processing delay, so they can't really put all of the words together, and the lack of expression becomes frustrating, so it's just best to keep quiet.
So then how do you carry on a conversation with a child who just can't communicate with you?
Well, I believe that there's an awful lot of communication. More than 70% of any communication is the nonverbal part, even when you're talking. I'm much more, autistic people are more like animals in the sense that you come in and say, "Hi, Rover," and you just broke the front end of your car. Rover hears you're upset and he's scared. You're saying nice things and he's picking up the emotions going on in your body.
So you think autistic children can do that?
It's much easier for us to pick up that than to pick up the verbal messages, especially when neurotypicals usually don't say what they mean. They say what's socially expected. The reason I read the body so well is, aside from being face blind, I would read the physical contradiction and relate to the contradiction. People would say, that's not what I'm feeling. I just told you. I would find out later it was exactly what they were feeling, and I was right, even though they denied it. And so the information I pick up is so overwhelming that I don't like being in large groups of people. I don't like being in public. It's too intense. But it works really good on one-on-one in the studio.
Yeah. Will there ever be a medication that will help? I mean, do we even know what or why autism?
We don't, Michael. Today, a lot of different medications are being used to alleviate some of the symptoms, but there's not going to be a quick pill to quote-unquote fix autism. And in fact, in the autism population, there are a lot of people that don't want to have quote-unquote a fix-it pill. They just really don't. And it has to do with acceptance, both with the individual with autism and also with the family members and the caregivers.
When do they develop? Would it be called separation anxiety?
The words are meaningless to me. I don't know what it means.
Well, all children go through developmental stages, right? Neurotypical children as well as autistic children. And one of the milestones is when you separate from your family, from your mom in particular. But autistic children sometimes, most often, have a lot of trouble separating from their mother or their caretaker.
Do they lack spontaneity?
I don't believe so. There was a young man whose parents, for like the first 11 years, he couldn't talk. He just had verbal tics. And one day he learned facilitated communication, and the mother said, my God, I want to ask you so many things. What interests you? Higher mathematics and comparative religion, he typed. And she said, what? What do you know about these things? She said, what do you think I was doing? I was listening all these years. I just couldn't form the words or respond.
But we don't know why. You're very emotional about this.
Yeah, well, this is where I live. And I've spent a lot of time being unable to come up with the appropriate thing to say. There's a commercial of a guy and a girl at dinner, and she says, darling, I love you. And he waits. She gets up and leaves, and he says, I love you too. But she's gone. Well, for autistic kids, that happens a lot. We can't come up with the socially appropriate response to express what we're feeling until it's too late or we get in trouble.
1 in 150 Americans?
Children born today are autistic, yes. But yesterday, I had the first gathering of, we've done a 2-hour, once-a-week thing where I work with 3 to 5 people who've had strokes. They came in, and I was able to look at each one and say, what can't you do? Mm-hmm. Become their body and say, try this. And a woman stood up for the first time on her own. Somebody else began using the deficit hand. Would you give up that kind of a gift for just being able to chat away madly?
I don't know.
Yeah, you chat a lot, but I don't.
I listen a lot.
You listen a lot.
I learn so much more by listening. I want to turn to the next call. Linda, let's go from autism back to stroke. What happened to you?
I was 49 years old, and I was...
Take your time.
Okay.
Is your speech affected by your stroke?
It was. I didn't speak at all when I came out of it. I was starting a new job the next day, and I was doing all my errands.
You work for Paramount?
I did.
Yes.
Mm-hmm. After my stroke.
Oh, really?
Yes.
Well, how many years ago did you have that stroke?
12 years.
Did you read that Dick Clark cover story that I mentioned earlier?
Yes.
Do you go to Johnny?
Yes. I read the article, and then there was a number, and I called it.
I noticed the more rapidly I ask the questions, the better you are giving me an immediate response.
I wasn't good at the beginning because I was nervous.
Hold my hand, madam. We'll do it together.
Okay. I was going out for dinner, and I hung up the phone, and that's the last thing I remember.
No pain?
Nothing. And the man I was dating came over 6 hours later and said to himself, my God, she's having a stroke. I was in a coma in my house. If he hadn't found me, I'd be dead. So I was in a coma for 3 weeks, and then I woke up, and I was pointing to the calendar, and I was thinking, today is my birthday, but no words came out.
Could have been your death day.
Right. But from that point on, I got better and better, and they told me too, 6 months, and I get better and better every day.
Well, you're actually involved, if I understand correctly, very fully in the world of stroke and recovery.
I do.
You run a support group at the Roxbury Center?
Yes.
How many people?
About 30, and we'd love to take on more. Come to Roxbury Park, and we'll take you on. I mean,
watch it, madam.
Well, sorry. It's a good group. It's a good group. Some of them went to Johnny yesterday. It's a really up group.
How much more do you expect or pray to be able to improve?
All the way. Every day, I get better. So, I don't think that there's any stop to my getting better. I do. And I learned to drive a car, and I go on trips.
That's the two of you driving cars now. It's getting less and less safe, you know that.
No. I'm sure that Johnny's very good at driving. So am I.
No, he's not.
Oh.
Okay. Am I right?
I'm terrified. My seatbelt is on tight.
And that's his wife.
Well, I drive very carefully.
Keep driving very carefully. Keep getting better. Linda, bless you for joining us. I want to turn now to Connie in Santa Monica. Hi, Connie. I love your hot dogs.
Yes, I'm here.
Okay.
Thank you. You ready for my question?
I'm ready for anything.
Yes. I understand Johnny works with individuals who are not afflicted with strokes or autism, what we'll call normal people, and works with them as a life coach.
Yes, that's right.
And how do your particular skills, best work with such individuals?
As a child, in order to know how to address people, I had to break them down into the child that they were by the way in which they walk. So I can watch someone walk, and the first thing I do in a session is tell someone what their childhood parenting was, and the parents were like around them, how they see themselves in relationship to the world. And then I see where there are blocks, emotional blocks, or injury blocks, and I show them how they run their life is exactly how they handle. One of the first things I do is say, how do you handle stress? And they come up with some nonsense, and I pick up a volleyball, and I make to throw it at them, and I say, that is how you handle stress. Look what you just did. And I use...
You reacted sanely.
Well, no. Some people put up their hands. Some people just don't do anything. Some people panic. Other people just immediately step out of the way. What you do with your body is exactly what you do with your mind and with your emotions. But if you don't realize it, you might have a series of maladaptive things that come from life events where don't take a stand because your father hit you when you did, so now you equivocate. Mm-hmm. And I bring these to light and show people how to establish stress management, physical first, because that's how you manage. The same modalities work for handling emotional stress as they do for physical stress, and how to find balance.
Connie, thank you very much for that call. They're very good hot dogs, actually. Give out, now you're looking quizzical.
How did she know about my life coaching? I think that's wild.
That was a he.
How did he know about my life coaching?
I haven't the foggiest idea, but he may well have read those magazines on which you were the cover boy.
I guess.
Our phone number is 1-888-458-1260. 1-888-458-1260. Next, we're going to meet a woman whose child had a stroke at a very early age. That and more. I'm Michal Jackson on News Talk 1260 and AM 540.
You're listening to Michal Jackson on News Talk 1260 and 540. To speak with Michal, call 888-458-1260. That's 888-458-1260.
Hey, there are so many calls that would you give out a number or a website or something? So the burden is off my back.
My website is biotyping, biotyping.com.
Biotyping.com.
Or just Google Johnny Seitz. Some will be about autism, but one of them will take you to my website. My phone is 310-714-5222.
310-714-5222. Okay. So we've been discussing stroke and autism. Both are rampant in our country. 1 out of every 150 children born today will be diagnosed as autistic. Source of that information? CDC, maybe?
CDC, exactly.
1 of every 16 deaths is due to stroke, so everybody knows someone who's suffered a stroke. Alice?
Yes?
What's your story?
Well, my son Aiden contracted a bacteria in the hospital at 2 weeks old and suffered a massive stroke. He's had 5 brain surgeries. He has a shunt implanted in his head from hydrocephalus, and he, over the past year and a half, began having seizures. He's got paralysis on the right side of his body.
Again, how old now?
He's just turned 5.
That's not fair.
Just turned 5, yeah. And he has an identical twin who is neurologically typical.
In other words, average.
Yeah.
Best of the worst, worst of the best, which is silly. But how does he handle his afflicted brother?
They get along beautifully. They love each other so much, and they take care of each other.
Probably communicate in a different way.
Yes, they absolutely do. And Aiden, oddly enough, is the more social one. And so Tristan is a little more shy, and Aiden is really outgoing. And
does it worry Tristan that Aiden gets more attention?
I think he worries about Aiden. He worries about him, and that's where Johnny and Chris have really helped us a lot.
How?
Well, the moment we walked in and I saw the way Johnny looked at him, I'm going to start crying, was just so, with such respect and joy and ease. And
do we know for sure that Aiden got that bacteria from the hospital?
We're pretty sure it was, yeah.
What's the likelihood of his getting considerably better?
I think it's good. He's made great strides, and he is very, very strong-willed. I call him by myself. And it's been difficult for some therapists to work with him because he's so strong-willed. He wants to do everything by himself. And the thing that Johnny does is he completely, kind of revels in that, and he enjoys him so much. He listens to him so acutely.
I've got just a few seconds left. How much better will he get? Not you, Johnny.
Oh, Johnny?
Yeah. I don't think there's any upward limit. And the joy of working and seeing the breakthroughs with people makes my life as rich as you could possibly imagine. So there's no upward limit for autistic kids or stroke victims, stroke survivors.
I know one who's now coming up to 5 years since her stroke. Will she progress?
Oh, yeah. She's already capable of taking 4 steps unassisted. She can walk with a cane, taking double steps for each movement of the cane. And slowly by little, the picture of herself that she has is evolving into what she's capable of.
You're not talking about Alana, are you?
Yes, I am.
Me too. Thank you both. Thank you all for coming.
Thank you,
Johnny
Michael.
Seitz, the website?
Biotyping.com, BIOTYPING.com, or 310-714-5222.
I can't even say goodbye.